Welcome to the University of Pennsylvania's Residency program in Family Medicine and Community Health. My name is Meg Bailson, and I'm the Residency Program Director here. Right now, I'm standing in the lobby of Penn Family Care, our main residency training site. We are located in West Philadelphia, right on the campus of the University of Pennsylvania. Please join me on this virtual tour of our program and practice. Penn Family Care is located on the 9th floor of this building. It is the largest practice at Penn, completing over 50,000 individual patient visits annually and caring for more than 25,000 patients, primarily residents of West Philadelphia. We have several alliances with local FQHCs and are in communications about a new alliance at yet another West Philadelphia FQHC that could serve as a second residency continuity site. As a residency program, practice, and academic department at Penn, our most palpable shared values are health equity and social justice. We are seeking residents who will join us in this important work as we strive for better health for West Philadelphia.
With such a large practice, we do our best to make it feel like 4 smaller practices in one through the use of suites of different colors. Each resident, faculty member, nurse practitioner, medical assistant is assigned to one of the suites where they see most of their patients nearly every session. This allows our patients to become familiar with a smaller section of the office and a smaller number of support staff. You and your patients will work with the same team members throughout all 3 years of residency. As residents, we begin developing our continuity panel from day 1. Residents and faculty are grouped into pods to help manage results and cover our inbox when we're out of town or on tougher rotations. The clinical space here is really an asset. There are huge windows making it a great space to work in. Every room is thoughtfully designed with a printer and a swinging table. The room can be arranged to accommodate patients with wheelchairs or families with children. This is one of our nursing stations, 1 station for each suite of each color. Each station is fully equipped for care of all types of patients, books for kids, injection supplies for joint care, other procedural supplies for gyne procedures, INDs, and skin biopsies. We also have 2 great microscopes with teaching monitors on the walls for wet mounts and KOH preps.
The majority of patients at Penn Family Care have government insurance, Medicare or Medicaid. We also have a large number of Penn employees, housekeeping staff, security guards, physicians, nurses, you name it, and a number of Penn students. About 15% of our resident visits are children, and we do a ton of prenatal care right here in this office. Most of our patients are Black Philadelphians, and we are acutely aware of the impact that generations of structural racism have had on the health of our patients. We have 2 large precepting rooms that also serve as touchdown spaces for people seeing patients in the office that day, physicians, nurse practitioners, and students. We also have a ton of interdisciplinary team support available to us. We always have a pharmacist available to ask questions or provide counseling to patients on new medications like insulin. We can also schedule pharmacy consults for patients for medication reconciliation or insulin titration. We have a team dedicated to wraparound care for patients recently discharged from the hospital that includes a nurse, a social worker, and a pharmacist. Our office also uses an integrated behavioral health model to help physicians connect their patients with psychiatry or counseling if needed. And some patients are able to see one of our 2 LCSWs for counseling in our office.
At Penn Family Care, we provide a range of outpatient procedures like colposcopies, IUD and Nexplanon insertions, abortions, both procedure and medication, and a range of dermatologic skin procedures like skin biopsies and sebaceous cyst removals. We know that for many of these areas, these are places where gaps can exist in care, leading to disparities in health outcomes. So for that reason, we feel passionate about providing this care here at Penn Family Care and training our residents to do so. We feel that allowing patients to get this care in their patient-centered medical home, their primary care practice, can really allow them to improve their outcomes in a place where they are comfortable and familiar. At our program, we use an embedded specialty clinic model where we pair residents with a faculty member one-on-one to learn best practices in an area of primary care. We use this model for MAT, or medication-assisted therapy, HIV and hepatitis, prenatal intake, primary care psychiatry, procedure clinic, LGBTQ health, and transitions in care for patients transitioning out of the hospital back into our primary care setting.
The campus of Penn Presbyterian is the clinical center of our program. With the exception of time on labor and delivery and time in the community, the majority of training is really at Penn Presbyterian Medical Center and its immediately adjacent outpatient practices. Presbyterian is an excellent hospital with some of the highest scores for patient safety and quality in the country. You will find it is a perfect place to learn inpatient family medicine. Penn Presbyterian was previously a small community hospital until it was purchased by Penn Medicine in the mid-1990s. Although it is absolutely an academic center, it is smaller and retains the community hospital feel. The majority of the patients in this hospital were admitted via the emergency department and are residents of West Philadelphia. The floors are small, and you will get to know the nurses, pharmacists, physical therapists, and other providers on a first-name basis during your time here. Our family medicine inpatient service is here at Penn Presbyterian. It is distinctly family medicine, staffed by family medicine interns, second years, and senior residents. We very often have sub-interns from Penn's medical school, as well as off-service rotators from PM&R and psychiatry. Most of the patients on our service are continuity patients of Penn Family Care across the street. We do also admit patients from several other local affiliated family medicine offices in West Philadelphia and one Penn internal medicine practice. We are also a resource for gynecologic and pregnancy-based admissions, as well as trauma patients who are pregnant. For all of these reasons, our service is highly valued here at Penn Presbyterian. Being a family doctor is more than just knowing the clinical medicine, the pills to prescribe, and the tests to order. It is essential for family doctors to understand just how impactful the social determinants of health really are. Here at Penn Family Medicine, not only do we want you to understand the barriers to health that exist in our community, but we also want you to be part of the progress towards health equity. We aim to give you the skills to make changes in your future practices and communities. Our program offers core curricular rotations in community and social medicine, as well as a dedicated community medicine track for residents who plan to work in an FQHC or other community settings after graduation. The Anti-Racism Task Force was founded in May of 2019 by a handful of faculty and residents with the goal of pushing our department along the continuum towards a truly anti-racist, multicultural organization. Over its first year, the task force grew in size and in impact, now with over 60 members, including residents, faculty, clinical support staff, researchers, and administrators. Subcommittee members work together to tackle a range of issues in 5 key areas: community engagement, education, employee engagement, patient care, and research. Past initiatives include workshops on structural racism and white privilege, residency curriculum reviews, patient care guideline changes, and voter registration.
As a resident here, you will be a part of a strong community of like-minded people. We are all here because we want to provide excellent primary care to the people of West Philadelphia. We view family planning as an essential part of being a primary care doctor. Residents are trained in IUD and contraceptive implant insertion and removal, miscarriage management, as well as options counseling and first trimester abortion training. We also provide training in colposcopy and endometrial biopsy in our own internal procedure clinic. Our program provides excellent prenatal training. In West Philadelphia, our patients face a disproportionate burden of obesity and hypertension and social stressors that increase the risk for our parents and babies. At our program, we take care of patients that would be considered high risk in many other settings.
One of the unique features of our program is that we provide really strong, high-volume obstetric training. While this is certainly more common for suburban and rural areas where residents are trained to competency in obstetrics, this is less common for East Coast urban family medicine programs. Our graduates are absolutely prepared to deliver babies and do not need fellowship training unless they desire to do C-sections. We have our own distinctly family medicine service at the main university hospital hub. This service is staffed by family medicine interns and upper years and supervised by family medicine attendings and nurse midwives. It is an integrated service that cares for birthing parents from arrival in the antepartum unit through to discharge postpartum and includes care of the newborn as well.
My name is Darcy McDonald. I'm the coordinator here in family medicine at Penn. I'm the unofficial den mother for all of the residents. I've been here about 17 years, and it's my job to try to make your life easier while you're doing your residency here. I've seen the program change a lot over the years I've been here. Most of the change has been initiated by the residents, as they've had input on the ways they would like to learn and the way they would like to teach others. I think the residents are probably my favorite thing about being at Penn. It's a wonderful place to be. There's a lot of resources. The faculty and staff are amazing, but the residents are hands down the best part of the program. So I hope we'll get to welcome some of you.
Hi, I'm Rich Wender, the new chair of the Department of Family Medicine and Community Health here at Penn. I too had a choice to make recently about joining this team, and I want to tell you why I decided to come to Penn. First, this is a unique moment in our nation's history as we have a conversation and a true commitment to the work to address years of structural racism that have affected our entire nation and certainly our community here in West Philadelphia. Second of all, through the entire recruitment process, the commitment of the leaders of this institution, the dean and the head of the health system, to tackling this mission were very clear, and there's no question in my mind that they're looking to this department to provide leadership for the entire enterprise. And third, I was so impressed by the people who are part of this department. True story, when I was recruiting, the dean went out of his way to tell me how extraordinary our residents are in the Department of Family Medicine here, and that certainly reflects everything that I've experienced since I've been on board. One thing I want to emphasize is that there's so much flexibility when you come to the Penn Residency, pursuing a career in research and community medicine, addressing the needs of special populations like LGBTQ health, chronic opioid use disorder, and of course, people interested in maternal child health careers. This is an absolutely outstanding place to come. It's all unified by our commitment to seeking social justice and pursuing health equity. Should you choose to come to this department for your residency, I can't wait to welcome you to our family.
Our program is seeking out residents who are passionate about social justice in medicine and who understand how critical the social determinants of health are in achieving physical and emotional wellness. I hope this tour has been helpful in making your choice of residency program, and I hope you will choose us for your training.